let's take one doc, two hygiene as an example.
Okay.
Five-op practice.
Okay.
That's kind of like, a lot of times it's like a starter practice, right? Like a kid comes out of school, they purchase their first practice. A lot of times it's like a 5 to 6 op practice with this setup. So one doc, two hygiene. Hygiene's booked out, let's say 4 weeks. They're having a hard time getting new patients in, and we're starting to see some of that emerge. What that is, that's demand on a third column of hygiene. But before that starts to happen, we start to notice the effects on the doctor's side. So as hygiene starts to get booked out and we have demand there, the doctors start to suffer. So you start to see periodics go on the rise, because at some point volume just trumps any efficiencies we may have. So if we do have new patient blocks in place, if we do have perio blocks, a lot of times the schedulers are blowing those out because they haven't seen Mrs. Jones in 9 months, right? So those get blown out, and then we start to see this stack effect. And then the doctors, they're doing too many exams in general at one point, particularly periodics. So as those start to rise, the restorative well dries up because there's not enough new patients. We can't get emergencies in, at least relatively easy. Same day treatment starts to drop because we're busting at the seams with the two columns that we do have. And so this starts to cause an effect on the doctors. And then you start to see like a plateau. And then we've talked about this a lot of times, Mark, the doctor production actually will start to kind of drop a little bit. That's down the road, but that's what you want to avoid. So starting with hygiene, as that demand builds, then you say, all right, like this triggers a third column of hygiene. Now, in a 5-op practice, that's not going to cut it. I mean, if you have 3 columns of hygiene and 2 restorative, like, first of all, I don't suggest any one doctor running 3 columns of hygiene. But secondly,
a single capacity already. That is recipe for not a fun life.
What's funny is I just got off a phone call with a doc who's been with us for a while, Mark, and she was like, I tried 3 columns of hygiene just 2 days a week, and I wanted to shoot myself. I'm like, well, yeah, of course. So again, as you have built demand for a third column of hygiene, that really does trigger the need for another doctor. So then you start questioning, how much space do I actually need to support that? And if you have 5 ops, that's not going to cut it. Ideally, the next stage would be an 8-op practice. So, 3 columns hygiene, full restorative, and an overflow, or some version of that. That'd be kind of an ideal setup as you're moving through that. So if you use that as your arithmetic, each stage of going from like 5 ops to 8 ops to 12 ops to 6 or 20 ops, whatever, going from 3 hygiene to 4 to 5 to 6, if you use that as your barometer, your formula litmus test, you can stay ahead of things. And what you're trying to stay ahead of is that declination of production in the office, the dry up of new patients because there's not enough availability, and overall just burnout with the team. There's no way. I've never met a team that hygiene, front office, assistants. I've never met a team that wants to do a bunch of bloody propies all day long either. So just overall burnout. It feels like you're flooring it, but you're just spinning your wheels because production is plateauing and eventually again starting to fall off. And before that, you'll start to see this teeter-totter effect that we talk about, Mark. Those with dam counts on the rise, production drops, and then you close restorative, but eventually it's just too much to handle. So those are things to avoid, but that litmus test is what I use when we're talking about expansion. And sometimes it feels scary, but lean on some of those numbers. If you're in this like limbo stage where you're not sure, it's scary to bring on an associate, or should I expand to 8 operatories and bring on all these hygiene and incur more cost? These numbers are usually a pretty clear indication you need that and confidence to make that decision.